Well, hospitals and health facilities in Gaza City and to the north of the Strip have been left in ruins by Israel's military operation. Al Jazeera's fact-checking agency, Sanad, has confirmed at least 8 facilities have been hit since early September. Now, the UN describes Gaza's health situation as catastrophic. Around half of the Strip's hospitals and just over a third of its clinics are barely functioning, and those still open are overflowing. Al Ali Hospital is treating more than 3 times as many patients as it's designed to. Al Shifa, Nasser and Al Razni are also crowded beyond their capacity. Now, more than half of all essential medicines and 2/3 of other medical supplies are out of stock. Well, to talk us through the ramifications of all of this is Hamida Jamahah, who is the country director for Plan International, a humanitarian organisation working to deliver aid into Gaza. She joins us from Amman. Now, when we run through the list of the issues facing the health sector, in particular in the north of the Strip, really is catastrophic as it's been described by the UN. Can you give us a sense of just how difficult it is for people there in the north of Gaza right now?
Yeah, thank you, Tom, for having me. After nearly 2 years of relentless violence, the people in Gaza are living through unbearable reality. And all of that applies also to the humanitarian workers and our partners on the ground, because they're basically trapped between the constant bombardment, the repeated forced displacement, in addition to the engineered famine created by the forced starvation. As you've just mentioned, every essential system has collapsed. We're talking not only about hospitals, but it's also water, education, and shelter. And basically, the majority of the families are being uprooted again and again, carrying what little they have left in their journey of forced displacement. And children, instead of being in classrooms or playgrounds, they're basically fleeing airstrikes and being starved to death. In the past week, the strikes on Gaza have intensified sharply. So basically, those strikes were targeting internally displaced people inside their tents, on residential buildings, on hospitals, and on the public infrastructure.
OK, we all know just how bad it is for people there in Gaza right now, but can you explain what Plan International is actually able to do to try and alleviate some of that suffering with Israel's blockade that's happening?
Plan International, with the partners, we are on the ground in Gaza delivering life-saving assistance with all the means available. We have been working with health facilities who have been also trying to navigate, the continuous displacement orders. They had humanitarian workers being targeted and killed. One of our partners lost an additional member of their staff along with her family in an airstrike last week. We have been trying to provide the very much needed life-saving aid through the access points from both Jordan and Egypt, although the limited humanitarian aid is still impacting the level of services provided. The partners' medical missions have either been suspended. One of our partners had to relocate to safer areas. We have been able to establish temporary learning spaces, providing psychosocial support to the children and providing a sense of normalcy back to children's lives. Even those temporary learning spaces have been forced to close, and the partners are now relocating to the south in search of safer areas.
Right.
One of the partners told us,
I just want to talk about how difficult it is for your organisation and many others to get humanitarian aid into Gaza, because I understand that only 30% of requests were permitted last week. I mean, how difficult is it, and what are you coming up against to try and get basic life-saving aid into Gaza right now?
We're doing all what is needed to do that in terms of engaging with the peer organization and humanitarian advocacy and diplomacy. We're engaging with the peer organizations on the ground to try to really provide the very much needed support. We're working on an interagency level also with the partners who have still areas that are considered in safe zones to relocate their staff and provide the interventions and the activities. We're providing hot meals and food kits. Where is it in the areas that are available? We are also working to provide the psychosocial support activities to children in safe areas. I just want to say that now with the relocation, also whatever applies to the people in Gaza also applies to the humanitarian workers. The estimated cost for relocation per family is around $3,000. So we're looking at transportation, tents, essential services about a month. So the majority of the families, and for those partner organizations on the ground, cannot afford this amount, forcing them to remain in their homes under fire as they lack the means to move to safer areas. So we're working on our duty of care to provide the support needed to the partners on the ground that are doing heroic jobs in order to save lives as much as they can.
And they, like you say, are living through the seas of Gaza City as well as trying to help people. Thank you so much, Hamida. We really do appreciate your time.
Thank you.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.